I'm Dr. Tejashree. I'm a fertility specialist practicing in FIRST IVF in Dubai Healthcare City. And right now I have just finished my day's work and I'm standing in the corridor of Mediclinic City Hospital, and I thought I will record this live video so that I can just give you a glimpse of what I did today. So let me start from the morning. I started my clinic at 9:30 a.m. in the morning, where I saw patients for infertility issues like primary infertility, secondary infertility. Then we also have ongoing stimulation cycles where we do the ultrasound, we do the blood test, and then we advise the patients about their IVF or IUI cycles. After that, I did embryo transfers for two beautiful patients of mine. One patient has a very unique problem. She had a kind of a history of cardiac surgery, and we had to take a cardiac opinion, and we had to get the whole fitness done before she gets pregnant. Thankfully, the cardiologist gave us the fitness and we could proceed with the embryo transfer. I put for her a beautiful blastocyst of grade 5 AA, and it was a very, very easy transfer. The second patient I had a history of primary infertility since a long time, and she also had endometriosis. She's of advanced age, 38 years old, and also we had to do laparoscopic surgery for her to check her fallopian tubes, and we had found that they were very much swollen with hydrosalpinx, so we had to remove them prior to the frozen embryo transfer. So her transfer also was easy. We transferred a beautiful blastocyst, hatching blastocyst, and everything went well. Then after that, I started my gynae clinic in Jumeirah American clinic. Now actually many of my patients get confused by the word Jumeirah American clinic, so they feel it's in Jumeirah. Actually, Jumeirah American clinic, the main branch is in Jumeirah, but the one which I visit is in Dubai Healthcare City only. So you see, I keep rotating here in this beautiful Dubai Healthcare City. You can see outside, it's a very nice weather and really beautiful. All my workplaces are here. First IVF is in Al Razi building in Block D on the first floor. Jumeirah American Clinic is in Al Razi building again, Block F on the second floor. And right now I'm in Mediclinic City Hospital. This is also in Dubai Healthcare City. I came here to do 2 hysteroscopy procedures. So generally what I do is, most of my patients, they come to me, then I work them up. I do their IVF. We make the beautiful embryos, and then after making the embryos, we generally need to check the uterus, because uterus factor is very important. If there is any problem in the lining, then again it's difficult to get pregnant. Like for example, both the patients I have done the embryo transfer today morning, I have already done their hysteroscopy, checked their uterus. So I did hysteroscopy for 2 patients today here in Mediclinic. The first patient was a case of polycystic ovarian syndrome. We did her IVF and we collected around 20 eggs. We got around 14 good embryos, but when we did the genetic testing, we found that only 4 embryos were normal. So you see, like, genetic testing or PGTA is very important so that we can select the embryo which we want to put. Also, we are able to put a single embryo because of the genetic testing, because like before, when we were not doing the genetic testing, to achieve the same pregnancy rate, we had to put 2 embryos. So this patient, she had 14 good blastocysts, but out of them only 4 are normal. So you can see the situation that 10 blastocysts were not normal. So imagine if we didn't have PGTA, it would have been so difficult for us to choose just on the basis of morphology alone. I did her hysteroscopy. She had 2 small polyps. I removed them. It was like a minor surgery and she's recovering very well. The second patient I had again was a 39-year-old patient with low AMH. So both the patients are like an antithesis. The first one was having polycystic ovarian syndrome with an AMH of like 9 nanogram per ml, and the second one is low AMH with 0.7 nanogram per ml AMH. Now, this is a low AMH. So low AMH is, another problem with patients. So the second patient, which I did hysteroscopy today, she underwent with me 3 natural cycles. So you can imagine how much difference there is, when you have a low AMH. Because what happens is these patients with a low AMH, they are not able to give multiple eggs in one cycle. So you see, IVF is like a basically number game. So if you are having polycystic ovaries and you are able to give, like the first patient I told you, she gave me 20 eggs, she had 14 embryos, and 4 normal. Now patients with a lower AMH, they are unable to give more than 3 or 4 eggs. So in such patients, I prefer to do embryo banking. Embryo banking is something where we do one cycle, we give them like some medicine, we make it IVF, like easy IVF, IVF light, because 3 cycles with injections is a big torture. So what I generally do is give medicines for around 10 days and maybe just 2 or 3 days of injections, and then I like collect the eggs, we put mix with the husband's sperm, make the embryos, and we bank them. So we do not run the PGTA at the same time. Then we do one more cycle. Now these cycles can be done back to back, or we can take gaps. So once we complete the 3 cycles, we have certain number of embryos frozen. So like this patient, she collected 4 embryos after 3 cycles. So you see the difference, that a patient with a higher AMH is able to collect 20 eggs and 14 embryos in one cycle with 4 normal, and a patient with a lower AMH needs 3 cycles. So let's say that she gave me these 20 eggs, or not even 20, let's say she gave me 4 or 5 eggs per cycle. So it's like 14-15 eggs in 3 cycles, and she had around 4 blastocysts at the end of it. And this is again, you see, out of the previous patient had 20 and 14 good ones. That's because the AMH, if it's higher, generally it correlates with the egg quality. This patient had around 15 eggs, the second one with the low AMH, and she had only 4 out of 15 good, not good, blastocysts. So, and out of these 4, again only 2 were normal. So you see, it's like low AMH not just reduces the number which you can give per cycle, but it also reduces the egg quality. There are chromosomal errors. So what happens because of these chromosomal errors is that the eggs which are making the babies, they are abnormal, like Down syndrome, trisomy 21, monosomy 21, monosomy 16. These embryos are not able to implant and give a healthy pregnancy. So for the second patient, we did the banking, 4 embryos, blastocysts. Now, when we did the PGTA, mind you, this 3 cycles, each month we are not doing the PGTA. We are like collecting, then we are, like doing one more cycle. And for this patient, I think I did these 3 cycles over a period of around 5 months, 5 to 6 months. So now, like I am doing her hysteroscopy. So imagine after the 5 to 6 months, she did the collected 4 embryos. Then we ran the PGTA and we have 2 normal embryos, beautiful embryos though. Now these are really high quality embryos, but of course, because it's precious, so I'm doing her hysteroscopy so that not to, leave any stone unturned. And she also had a polyp. So she had a big polyp, in fact, around 9 millimeters in the posterior wall. So I removed that polyp and I've sent it for biopsy. Now I will wait for the biopsy report. And generally these patients, after hysteroscopy, I give them like 2 weeks break, so that they can heal. And till that time the biopsy report comes. Now in the biopsy report, I'm looking for any kind of hyperplasia or overgrowth, or something like inflammation like endometritis, or maybe sometimes we get a simple report, proliferative or secretory, which is like a normal report. So once the biopsy report will come, I will call these patients again, and then I will plan the embryo transfer. So you see, and today 2 more things happened. I have 1 patient negative pregnancy test and 2 patients positive pregnancy test. So this is happening, like I'm doing this since 15 years, and even though we do PGTA and everything, we cannot get 100% pregnancy rate. So we are always counseling. And the good news is that the 2 positives which I got are really tough patients. One of them came to me, she had 2 failed IVFs in UK, you know, and every time they had put for her 2 embryos. And for me, I put for her only single embryo. She has very strong endometriosis, adenomyosis, so we gave her immunomodulation. So we are giving intralipid infusion and some steroids, Clexane injections, you know, kind of to help implantation. Of course, hysteroscopy was already done, and I also did for her the ERA test just to be safe. And lo and behold, she's pregnant. She couldn't believe it only. But her beta HCG level is very good. It's like 300 something. So she's very nicely pregnant. Now just crossing the fingers, and you know, we will monitor her. But I have given her really many medicines, everything under the sun. So I'm quite hopeful that the pregnancy will go well. And the second patient who got pregnant is one of the banking cycles. She is having AMH of 0.7. And my goodness, she's also been with me since 5 months, the same journey. She did like the banking 3 cycles. We, you know, kind of froze the embryos. Then we got normal embryos. Then I did a hysteroscopy here only in Mediclinic. Then we got the biopsy report. Then we got the periods, and then we did the IVF. I mean, sorry, not the IVF, the embryo transfer. And now she's pregnant. So you see, my full day is very eventful. I see many kinds of patients. I'm also a gynecologist, so in the middle I do get patients for like IUCD insertion, or like one of my patients is asking me about the HPV vaccine, pap smear. So it's fun. Okay, so of course I do get tired. It's really exhausting sometimes, but I really love my profession. So thank you for listening to me, and good luck. Take care, friends. And in case if anybody wants to see me, I'm available at FIRST IVF every day. Like generally my timings start at around 9:30 to 5:30. And of course, if you will Google FIRST IVF, you'll get the numbers. And if you want to see me with insurance, then you can see me in Jumeirah American Clinic. Again, let me remind you that Jumeirah American Clinic is in Dubai Healthcare City only. The branch I go to, not in Jumeirah. It's in the same building as FIRST IVF. Mediclinic City Hospital, I am just having a part-time attachment here for my operative cases. I do not have an OPD over here. I don't see patients here. So I'm going to leave now. See you. Good luck. Bye-bye. Take care.